G'day, so this is my Assignment 3 Exercise Intervention online presentation. Today I'll be talking to you about colon cancer by William Edwards. So to begin with, we had to develop an authentic cancer client case study. So to begin with, my case study begins with my patient Peter Smith, who is a 51-year-old male who has been diagnosed with colon cancer. As you can see, Peter was diagnosed with T4, which is where has the tumour grown, and it has started to grow into the wall of the colon or rectum, how many layers. N0, which is the nodes, how has the tumour spread to the lymph nodes, if so, where, how many. And the metastases, M0, where has the cancer metastasized to other parts of the body. So with Peter, as you can see, the tumour had grown fully into the surface of the visceral peritoneum, which means that it grows through all the layers of the colon. The cancer had not spread to any of the nodes, and it had not metastasized anywhere. This placed Peter in either a stage 2B or stage 2C of colon cancer. So Peter recently has now been 5 years cancer-free. Peter is an office worker who works in a building within the city, commutes to work via the train. He's currently overweight with a BMI greater than 30. He's a social drinker who drinks roughly about 3 standard alcoholic beverages per day and is a non-smoker. So to begin with, let's discuss a bit of what colon cancer is. Colon cancer, or also known as colorectal cancer, is the second most common cancer found within Australia, and it is more common in people over the age of 50. And as you can see, that Peter is 51, so therefore you had an increased risk of developing it. In 2017, it is estimated that there will be 16,682 new cases diagnosed. Most often, this affects the large intestine, which is often where the polyps begin to grow. Colon cancer diagnosis. There's multiple ways in which colon cancer can be diagnosed. The main ones which include colonoscopy, sigmoidoscopy, blood tests, biopsies, CT or MRI scans, PET scans, and ultrasounds. A number of tests that were used to diagnose this initially are prescribed by the doctor or the physical examination to feel if you have any abnormalities or swelling. Treatments for colon cancer. The primary treatment for colon cancer is surgery. As you can see, Peter is in a stage 2 of colon cancer before becoming cancer-free for 5 years. The main treatment for early bowel cancer is normally surgery. This often results in a colostomy bag or the joining of an anastomosis. Secondly, you have radiotherapy. Radiotherapy is often used before surgery for local or advanced rectal cancer. As Peter has such an advanced form of cancer, surgery would be the best option. You have adjunctive treatment or chemotherapy, which may be recommended after surgery. Finally, there is palliative care. This is often for, in some cases of bowel cancer, where the medical team may require aims to improve the quality of life as without curing the cancer. Colon cancer symptoms and side effects. There are several symptoms of colon cancer which can be either specific or non-specific. Some of these symptoms can include fatigue, weakness, shortness of breath, change in bowel habits, diarrhea, constipation, blood in stools, abdominal pain, cramps or bloating, and weight loss. With these symptoms, not only can there be other conditions that can mimic these, but it is important to keep on top of it and check with your local GP. For the client initial consultation. Before beginning any exercise, it is important to have an initial consultation with your client in order to provide an understanding of what your client is on. Client initial consultation. Before beginning any exercise or prescribing an exercise program, it is important to have an initial client consultation. Throughout this initial client consultation, both the exercise physiologist and client need to come to an agreement on what the client's needs are and their goals. Throughout Peter's initial client consultation, it can be seen that Peter wants to have a greater understanding of his colon cancer. There needs to be a decrease in his blood pressure as Peter is currently hypertensive. There needs to be a decrease in Peter's BMI as it is currently greater than 30, and needs to be a decrease in the hip to weight ratio measurement, which is currently above 0.9. With Peter, there needs to be an increase in physical activity and strength for his work. Currently, he is very sedentary. Peter needs to be able to work a whole working week in order to support his current family, as he lives as a single parent looking after 2 children. At the moment, Peter is currently only working part-time. Peter needs to be able to decrease his drinking, as he's currently drinking greater than 3 standard drinks per day, as well as he needs to be able to be educated on current nutrition. At the moment, Peter is currently eating out multiple times per week. After discussing these needs with your exercise physiologist, it is important to establish specific goals and priority areas which Peter can achieve. For Peter, it is important to have a sound understanding of what type of cancer he has overcome. As Peter is now 5 years cancer-free, it is important to understand what he has overcome in order to look for the future. It is important for Peter to have a decreased blood pressure target of less than 150 systolic, as he currently is hypertensive. It is important for Peter to lose weight with a target of BMI less than 28 and a hip to weight ratio of less than 90. This will occur if Peter has a goal to increase his physical exercise activity and also to improve his aerobic capacity and increase muscle. Another priority goal is for Peter to decrease drinking to 1 standard drink per day. Additionally, for Peter, this could be to start cooking meals rather than getting takeout. The meals which he could be cooking should be high in fiber and low in fat diet. It is important to set up a team care arrangement for your client in order for the allied health professionals working with Peter to have a greater understanding of what their role are and the goals that Peter is trying to achieve. 3 allied health professionals which can be involved within team care arrangement for Peter is 1, an accredited exercise physiologist, who is an allied health professional specifically trained to develop and implement exercise intervention to aid in the prevention and management of chronic disease. The exercise physiologist will assist Peter in his goal of improving his physical fitness. This will be done by implementing a tailored exercise program that will optimize and improve his aerobic capacity and increase muscular strength. By increasing this exercise capacity, similarly, Peter will also decrease his blood pressure, BMI, and hip to weight ratio. The second allied health professional involved in the team care arrangement is an occupational therapist. OTs are client-centered health professionals who enable patients to participate in the activities of everyday life. OTs will assist Peter in his ability to perform daily tasks without feeling fatigued, with the aim to optimize independence in activities of daily living, ADLs, and instrumental activities of daily living, IADLs. This independence and education will assist Peter's goal of returning to full-time work and will improve Peter's range of motion post-surgery. OTs will often work in conjunction with AEPs to maximize physical activity during cancer treatment and survival afterwards. Finally, the last allied health professional in the team care would be a dietitian. A dietitian is a qualified individual who applies science of nutrition to the feeding and education of individuals in health and disease. Dietitians will assist to design weekly meal plans and healthy cooking options for Peter in order for him to achieve his goal weight and better eating habits. By implementing a high fiber and low fat diet in conjunction with exercise programs, this will assist with Peter achieving his goals. Not only with better education of what type of meals are appropriate post-surgery, this will not only help in reducing pain but also discomfort. Assessment procedures. There are several baseline and benchmark procedures which need to be assessed before prescribing an exercise program. It is important to obtain a baseline set of observations prior to the commencement of starting an exercise program. These include heart rate, blood pressure, respiratory rate, hip to weight ratios. After assessing muscular strength and endurance, it is important for development of effective exercise prescription. Some of the tests which will be included for Peter will be a 1 repetition maximum bench press test, a push-up test, 6-minute walking test, and a SEP test. As you can see, Peter performed poorly or average in most of his assessments. With the 1 RM bench press test, Peter scored an average of 0.65 of his body weight. For Peter's age group, this places him in the poor category of the normative data. For the push-up test, Peter was able to do 10 push-ups. Based on his age group of 50 to 69 years of age, this placed Peter into the poor category once again. With a 6-minute walking test, Peter only was able to walk 480 meters. Once again, by looking at the normative data, we can see that for his age group, the mean distance walking was 592, placing Peter a lot below the mean distance. Finally, Peter performed a YMCA 3-minute step test. Peter had a 122 beats per minute, 1 minute post step test. This once again placed Peter in the poor category for his age group. By having these baseline data, we can now set specific goals within our training program for Peter to achieve. With our evidence-based exercise program between weeks 1 and 3, we can see that Peter began with majoritively body weight exercises, with a long rest between exercises and a greater duration. Exercise was split up between both resistance training and also using aerobic exercises. Between the weeks of 4 to 6, we can see that there has been a progression to increase Peter's aerobic and anaerobic capacity. Not only is there an increase in duration, as well as sets and reps, there is a decrease in the rest time between exercises. Exercises that were previously being used for body weight have now been replaced with either dumbbells or barbells, which allow Peter to increase his muscular strength. Aerobic exercises that were previously light intensity have now been increased to light to moderate intensity. Finally, within weeks 7 and 8, or the last 2 weeks of the program, we can see that there is quite an increase in the duration, sets, repetition, and a decrease in the rest time between exercises. Exercises have been increased to exercises without assistance, as well as increasing the intensity of the aerobic exercises. By gradually increasing the intensity of these exercise program over time, we can now allow Peter to achieve the goals that he desired. So g'day guys, my name is Will, this is Alison. Alison's kindly volunteered to help us out today to demonstrate one of the exercises that's involved within our exercise program for the cancer patient case study. So the exercise we're going to be performing today is a bilateral leg squat. We're going to modify it a little bit for Alison, which will be in the program as well, just to make it a little bit easier for her, and we're going to go from there. So before we start the exercises, what we want to be doing is getting clearance from our doctor to say that we're able to participate in the exercise. Alison's already provided me with that, which is great. Secondly, we also want to get informed consent. So not only have we had written consent earlier when she filled out her form, but what's going to happen today, Alison, is I'm going to perform the exercise, and then afterwards I'm going to demonstrate it, and then I'll get you to perform it afterwards. Is that alright with you?
Yeah, sure.
Okay, so what we're going to be doing today is a two-legged squat. So I'm going to get hands out, okay? And as we go down, we're going to get to that 90 degrees and back up. As we go down, we're going to inhale and then exhale as we come up. What I'm going to do today, though, with your to make it modified, what we're going to do is I'm going to put the chair behind you, okay, which will help create a guide for when you're going to be stopping. So what I'm going to do with the chair, so as you go down, when you get to that chair height, I'm going to demonstrate first and then you perform. Get to the chair, as soon as you hit that chair, come straight back up, okay?
Okay.
So go down, yeah, and touch that chair, and back up. Well done. Remember to inhale on the way down and exhale on the way up. Alright, any pain there at all?
No.
Okay, great. Alright, so what we want to be aiming to do with this exercise, we want to be doing about 5 to 10 repetitions with about 2 to 3 sets of it all. Before we do these exercises with Alison, what we did was we performed her blood pressure, heart rate, rest rate, oxygen saturation. We did a whole primary and secondary survey looking at if there was any pain experiencing. Alison denied any of this, and all her observations were in normal range, which is great. Throughout the exercises, you notice that we have a heart rate monitor, which we're monitoring her heart rate through, as well as a chest strap. So some of the red flags we want to be looking at, if there's any pain experiencing, any chest pain, tightness, dizziness, lightheaded, nausea associated with any of this exercise, please let me know. Alright, I'll be monitoring your heart rate, but if anything does change, just let us know, okay? So like the modifications, like we said, so as we go down, we're going to be touching it and coming straight back up. An alternative to this as well, what we want to be doing, we can always hold the back of the chair, okay? So one of the other ones, so what I'm going to do, you hold the back of the chair as we go down, down, and back up, okay? But I'll get you to give it a quick go. And back up. Okay. That's great, well done. Alrighty, so after all that, great, so before we start these exercises, what we want to have done already, which we already have, is done an appropriate warm-up. This would include stretching, light jogging, okay? Don't want to be doing too much for you at the moment, but anywhere from 5 to 10 minutes, okay, that increase in that heart rate, keeping that blood flowing, okay? After we finish these exercises, what we want to be doing is a light cool down as well, alright, so involving stretching and lowering your heart rate, which we can monitor once again via that heart rate strap. Okay, great.